We learned last year that if you don't mix with a lot of other people, the flu has nowhere to go.
Last season, there weren't many influenza cases, credited to pandemic isolation and social distancing measures. But with many COVID-19 restrictions gone and people mixing again, this year could be a different story.
The range of the seriousness is quite wide. And I really hope that we hit the lower end of seriousness, but the potential is quite large, and it's concerning because right now our hospitals are pretty close to capacity, and there's no flu yet.
Dr. Heidi Meyer is a family physician for Kaiser Permanente. She's telling her patients to get the flu vaccine by the end of October to be ready for a potentially early influenza season.
This is the year to get it, and even if you think you don't need it personally, get it for the healthcare workers, get it for the hospitals that are overwhelmed still, that are working at 85 to 90% capacity. We don't want to get to the point where we are running out or out of beds.
Meyer says, like coronavirus, age and underlying conditions can lead to bad outcomes with the flu.
The worry is that someone could get the Delta variant and they could also get infected with the seasonal flu that might not normally affect them severely, but if they get both at the same time, a young, healthy person could die from the combination of both of those, whereas they would never die from one or the other.
She's also expecting an increase in coronavirus testing, as it can be hard to tell if it's just the flu or a mild case of COVID.
I would encourage people to get themselves tested, ideally about 72 hours after any symptoms start, isolate prior to testing, and then wait for that negative test before you go back out into the world.
Meyer is encouraging people with flu or COVID-like symptoms to mask up because it could save a life. Matt Hoffman, KPBS News.